Hi, my name is Jonathan Chang, and I'm a retina specialist at UW. And I'm here to talk to you about age-related macular degeneration, or AMD. And we'll answer 5 common questions about AMD. Number 1, what is AMD? AMD, or age-related macular degeneration, is a common condition that affects the macula, the central part of the retina. And this usually affects older adults and is a very common eye condition. The macula is responsible for our central vision, and over time this may deteriorate and start to lose some of its function. There are 2 forms of macular degeneration: dry macular degeneration, which is the most common form, and often patients with dry macular degeneration don't even notice that they have any symptoms. Over time, however, they may start to lose some of their center vision, may start noticing some distortion or waviness to straight lines, and notice some missing spots in their vision. Usually the process that affects vision with dry macular degeneration is very slow. However, in the long run, it can lead to very significant vision loss and formation of thinning of the retina called atrophy, where the macula or the retina loses some of its ability to function properly. The second form of macular degeneration is called wet macular degeneration. This form is less common but also more aggressive. The changes happen more rapidly and more quickly, and sometimes people can notice a sudden appearance of some waviness or missing spots in their vision. This occurs because fluid builds up and makes the retina thicker in these areas. Fortunately now there's a treatment for this condition, and it's a treatment in the form of medicine that we give as an injection inside the eye. While it can't return vision totally back to normal, it can still preserve and improve vision in many cases. Question number 2, should I take eye vitamins? Well, not everyone needs to take eye vitamins. If you have been diagnosed with macular degeneration, there is a particular combination of vitamins called AREDS, A-R-E-D-S. This contains vitamin C, E, lutein, zeaxanthin, zinc, and copper, and this combination has been proven to reduce the risk of development of advanced macular degeneration. However, this was only checked in patients who had pre-existing macular degeneration, and so it's not known if this can prevent the disease in patients who have not been diagnosed with it. Question number 3, should my family members be checked for macular degeneration? Many of our patients with macular degeneration want to know what to tell other family members about their risk for developing macular degeneration. And it's true, there is some linkage with macular degeneration that runs in families. There are a number of genes that are involved in determining, or that may determine, that someone develops macular degeneration. However, right now routine testing or routine genetic testing is not recommended for macular degeneration. It is recommended, however, to have annual eye exams after the age of 60, especially in patients with higher risk for macular degeneration. Also, patients of Caucasian descent may be of higher risk for developing macular degeneration. Question number 4, what can I do to reduce my risk of macular degeneration? There are several things that can be done to help reduce the risk of macular degeneration. First, people who smoke cigarettes are at much higher risk of developing advanced forms of macular degeneration, so stopping smoking is a huge help in terms of reducing your risk. Second, the same things that are involved in heart health, things like reducing your blood pressure, maintaining a good body weight, regular exercise, also appear to be beneficial in reducing the risk for macular degeneration. And finally, foods that are high in lutein and zeaxanthin, things like green leafy vegetables and brightly colored foods and fish can also be helpful in reducing the risk for macular degeneration. Question number 5, what can I expect from a regular eye exam to check for macular degeneration? In an eye exam for macular degeneration, you may have your pupils dilated. In this case, the eye doctor will look at the retina and may look for little yellow deposits called drusen. Drusen can be an early sign of macular degeneration, and also can be a sign that you're at risk for macular degeneration. In some cases, you may also have special photographs of the retina taken or a scan called OCT, and this is able to check for early signs of macular degeneration as well.